Everybody who comes in for lung surgery is like to have a very different experience of their time. However, many patients do find it quite helpful to hear how other people before them have got on with their treatment. And we've asked two patients, Sarah and Clifford, to talk about how their lung surgery went. These two patients both happen to have been diagnosed with a cancer, but actually their experiences are probably very similar to many patients who have lung surgery here at Royal Brompton or Harefield Hospital.
You've got to trust somebody. So these people are experts, they do nothing else. So you've just got to put your trust in them and they won't let you down.
Once I knew I was going to have the surgery, I was so relieved and I thought, good, I don't need to worry anymore.
When it sunk in, that I was more or less sure that I'd got cancer, a fairly swift appointment was made here for a PET scan. Which came out positive, as it were. And then within days, I had an appointment to see the surgeon, Mr. Dusmet. And I was told to bring overnight things with me, as I may well be booked in that night into the hospital and operated on the following day.
I was quite relaxed about what was going to happen. My son brought me over. We had to come the night before. So we decided we'd go and have a meal just down the road at the pub.
The day you actually come in and have your surgery can be a very worrying and emotional time for you. But it's important to remember everybody reacts to this in a very different way. It's also important to think that not everybody can or wants to have lots of family members around them on the day of their operation, and that's completely up to you how you want to be.
After the surgery, I woke up and we went down the corridor and my children were lined up down the corridor. And the first thing I thought was, want them to touch me. So I said, touch me. And they all did. And then they went into the ward. And I think they must have come into the ward as well, but the memory of that is very vague.
It's all a bit vague. Coming round then, I felt pretty drowsy from the anaesthetics, but they allowed my wife in to see me.
I don't remember having enormous amount of pain ever. It was you had a little button which you pressed when you wanted when you thought you were feeling a little bit uncomfortable.
The next day, the physios got me up. Walking the ward with my stand with my drips and bags and God knows what on. We just did the ward and back, and then I had that every day and it just got a bit better and longer. And once I was gradually disconnected from everything, the catheter came out and the drains came out, and then you feel much more comfortable.
Everyone will recover at their own rate after surgery, and it's very hard to give you hard and fast rules about what you should be doing once you've had your treatment. Both Sarah and Clifford found it very helpful to contact the hospital after they'd gone home with further questions and queries about their treatment to help them in their recovery.
Well, I think by the time I came to leave the hospital, I was quite confident. And I'd got the children with me, and I was also, I didn't really want anybody else to be around. I think I was ready to go home. I was strong enough to be able to walk down the corridor to go to the loo.
Half the battle is knowing what to expect. And if you know what to expect, then you don't feel worried about it. So if something you weren't sure of, you could phone up and check it out, and they said, yes, this is quite normal, blah, blah, blah. And it made you feel much easier, and generally happier at home.
I remember doing my first shop on my own up into Crystal Palace. And I remember getting up there and then going into a coffee shop and having coffee, and then managed to get myself all the way back again. And then I thought I'd beaten it.
We recognise your experience here will be unique to you. However, we really hope that you found it helpful hearing two other people's experiences and the emotions and concerns they've had through it. And we hope that will help you understand a little bit better about what it's like to come in for treatment here.